Hi, everyone. Today we are going to be talking about social vulnerability and equity, the disproportionate impact of COVID-19 by Tia Gaynor and Megan Wilson. Socially vulnerable communities struggle more when recovering from disasters. Black people typically disproportionately affected by COVID-19 are typically disproportionately affected. This study looks specifically at Cuyahoga County, Ohio, and Wayne County, Michigan. Poverty, poor housing, and inadequate transportation make an emergency worse on communities. COVID is sometimes seen as an equalizer, but students of emergency management have found that more vulnerable communities are less resilient in their response to disasters. 40% of COVID-19 hospitalizations were from Black people, which is larger than the percentage of the population that this identity includes of the United States. Black survey respondents were twice as likely to say that as white respondents to say that they knew someone who was hospitalized or died from COVID-19. Both counties observed in this study have the highest Black populations within their state. Business deemed essential during the pandemic were more likely to have a higher percentage of Black employees. The Social Vulnerability Index was designed to easily identify communities most at risk. Not all states shared race-specific data. Even among the states that do not report race-specific data, it is not uniform across different states. Wayne County, Michigan has an SVI score of 0.87, making it a highly vulnerable community. It is also a densely populated community, which makes it challenging to effectively socially distance. Wayne County has 8 times the infections and 16 times the deaths of Cuyahoga County. Black people are more likely to need respiratory therapy when infected with COVID-19. Rate of infection are underreported due to lack of free and available testing. Thank you. I'm sorry. I don't think I should talk about the last slide. Economically challenged areas typically have higher vulnerability rankings. We see similar disproportionate effects for Black people in the cases of Hurricanes Katrina and Harvey. Researcher Powell challenges the public not to see COVID-19 as an equalizer, but to recognize how it impacts different people in different ways. The first step to combat unequal effects of the pandemic is to identify a universal goal. Next, identify populations at risk. Then, develop and implement targeted strategies to aid in the collective goal. Now, thank you.